So let's dive in. Let's look at the first risk that will blow up your retirement is healthcare costs.
Yeah, and here we are. This is a 65-year-old. This is from Fidelity Benefits Consulting. Actually, a 65-year-old married couple retiring today. It's estimated that lifetime medical costs will be $220,000 for the couple. And that doesn't even include long-term care if needed. So this is something, it's not a mystery. We know that as we get older, more things happen, and we got to be prepared for it. But the expense of it is can be staggering.
So you got to think of it. All right, do you have an extra $200,000 just socked away just to cover medical costs? I mean, those are co-pays, those are prescriptions, those are all sorts of different things that you pay for each and every day. But a lot of that is covered through your normal health insurance. Once you're retired, you go on to Medicare, then you have Medigap policies, then you get in the ABCs of all that. I mean, that's a whole nother topic, a whole nother show. But you have to be prepared for upcoming, medical costs, because that's a huge concern that will drain a lot of money from your overall nest egg.
Yeah, absolutely. And when you think about it in terms of long-term care, so that $220,000 doesn't even include long-term care. If you do need long-term care, then of course it's going to cost a lot more. And let's get into the stats, because when you talk to insurance companies, they tend to scare you, although there is some merit there because it can be pretty expensive. But this is from a white paper that came out, a research team in 2005, and they found out that a 65-year-old had 42% of 65-year-olds will have no need for long-term care over their lifetime. 27% will pay somewhere between $1 and $25,000. Another 25% will pay $25,000 to $250,000, and unfortunately 5% of you will pay over $250,000. So those are the stats. That's what you have to be aware of. And remember, that's in addition to that $220,000 figure that we told you.
So yeah, long-term care, it's looking at, all right, well now I need to go into a facility, or maybe it's in-home care, someone to help you. And then when it comes to long-term care stay, there's activities of daily living, transferring, dressing, bathing, things like that. And if you can't perform 2 of those daily activities, then that's where you go into a long-term care stay. So you have to have a plan for that. Is it insurance? Is it going to be self-pay? Is it going to be the kids? Maybe the kids will be your long-term care policy, which a lot of people might look at.
Yeah.
But here, take a look at this number. How much money, if you have to go into a long-term care stay, looking at the cost today, it's about $7,000 per month. $7,000 per month is what would have to come out of pocket if you need to go into a long-term care facility. Let's say 10 years from now, that number's $11,000 a month. 15 years, it's 14, 20 years, it's close to 20 grand. Now that's looking at a month, and that's a national average.
Right.
So if you go to Southern California, where do you think those costs are? Today, it's not $7,000 a month, right? Yeah. It could be close to $10,000 or $12,000, depending on what facility that you go into.
And if you want an ocean view, forget about it.